Hi, I'm Dr. Dan Shapiro. I'm a board-certified plastic surgeon certified by the American Board of Plastic Surgery, and I've been practicing in the Scottsdale, Paradise Valley area for over 21 years. Today I'm going to talk about a commonly asked question, what is the recovery process like after a facelift? And I'll go through the whole process both before and after surgery today. If someone comes in for a consultation and we talk about what I think a patient could benefit from and decide to have the surgery, the first thing we do is give them a list of medications to avoid to try to minimize any bruising after surgery. It's always difficult to avoid completely any bruising or swelling, but we try to do things to minimize that, and that would be avoiding common things like Motrin, aspirin, vitamin E, and a whole list of medications that we'll go through with you. Also, we like to have patients have a heart rhythm strip and some blood work if they're over 50 in order to have the general anesthesia. So now let's go to the day of surgery. A patient will come in having taken some medication the night before to help them relax a little bit, and then have the surgery. After surgery, patients generally spend about an hour in the recovery room and then go to our surgical recovery center. That surgical recovery center is staffed 24 hours a day by our nurses, and this is a certified facility. That evening, patients are medicated, and surprisingly, there is minimal to no pain after having facial surgery. Commonly, I will add a brow lift or some eyelid surgery to the facelift, and that will go into the equation about the recovery process. After surgery, the next morning, I come in and see the patient, and then I take some drains out that drain any fluid in the neck, and then patients go to my office and have their hair washed. The next day, or the day after surgery, patients go home. And the main thing patients have to remember is just to keep their head elevated, not to sleep with a pillow, but a roll towel, and keep some frozen peas on their eyes. That swelling generally peaks out at about 3 days, and bruising generally peaks out about the same time. The first post-operative visit in my office is generally about a week. Sooner if there's any issues, but generally about a week, patients come in and have stitches removed for the majority of their facelift and their eyelid surgery. So let's say it's day 7, a patient would come in, have their eyelid sutures taken out along with most of their facelift sutures. Those sutures along the inside of the ear, beneath the chin, and sometimes near the scalp are taken out. 3 days later, which is about day 10, patients come in and have everything removed. So what does generally a patient look like at this point? Occasionally there's some lingering swelling. There may be some bruising beneath the eyes and very low in the neck. But generally about that time, about 10 to 14 days is when patients feel that they can comfortably socialize, albeit it's feeling like you have a bad hair day. Patients are starting to look a little bit more like themselves. Depending upon how much work I do will determine how much swelling and bruising there is, but generally about 2 weeks is when people feel comfortable going out and doing their things. The questions like coloring hair, generally that is performed at about 3 weeks after surgery, and I think about that time patients really feel like they're getting their spring back. Thanks a lot.